Okay, welcome everyone. My name is Emmett Collins. I am the chair of the board of IPAC Manitoba. And this is the IPAC and SQP webinar on behavioral insights in the context of COVID-19. We're happy to partner with service quality partners on this event. And I'd like to particularly thank Angela Colombage, who has been really instrumental in pulling this event together, although she could not attend today. So I'd like to begin with a land acknowledgement. IPAC Manitoba is located on the ancestral lands of the Anishinaabe, Ininiwak, Anishinaabeg, Dakota, Dene, and on the homeland of the Métis. We acknowledge the distinct histories of the 7 numbered treaties that apply on this land. We recognize that public administration and public policy have been used as tools of colonialism and the harm this has caused Indigenous people. We are committed to promoting public administration in a way that advances reconciliation in a spirit of collaboration with Indigenous people and communities. So for those of you who may not be familiar with IPAC, we are the Institute of Public Administration of Canada, and Manitoba is one of the 19 regional groups. So we are a not-for-profit. Our Manitoba group is volunteer-based, and we just pull together events around public administration policies. We have learning events like today. We have awards that celebrate excellence. In the past, we have had networking events, just informal events for people to meet each other. It's a little bit more complicated in this current period, but this is sort of the broad scope of what we do. If you are interested in learning more, I encourage you to reach out to us at manitoba@ipac.ca, or you can find us online at ipac.ca/manitoba. A couple of logistical items to go through. So this session, you may notice there's a little recording icon. So this session is being recorded and will be posted online at a later date on the IPAC National YouTube page. Everyone is muted as a default, and we ask that people comment in the chat. So the chat is open. You can ask questions at any point. And what we'll do at the end is when we get to the section on questions and answers, I will read off your questions and then Sasha will answer them. Our speaker today is Sasha Tregobov, who is a director with BIT Canada, or Behavioral Insights Team Canada. Sasha opened BIT's Canadian office in 2019, before which he led BIT's work with US local governments through the What Works Cities program. Before joining BIT, Sasha was a policy advisor with the Ontario Public Service and a manager in Deloitte's public sector consulting group. Sasha is passionate about helping Canadian governments better understand and use behavioral insights. So without any further ado, I will now pass it over to Sasha.
Thanks so much, Emmett, and hi everyone. Thank you for taking an hour out of your day for this session. I hope you enjoy it. It's a bit of a special opportunity for me anytime I get to engage with the public service community in Manitoba. Just on a personal note, I grew up in Toronto, which I apologize for, but my whole family, other than me, my parents, my grandparents, my aunts, my uncles, my cousins, everybody else is in Winnipeg, and I have really fond memories. Every summer when I was growing up, parents would pack me up and ship me out to the grandparents who were in the north end of Winnipeg, and I still get to visit the city and the province a lot. So it's really a pleasure for me to be able to join you today, and I hope you find the presentation interesting and helpful for the important work that I know everyone is doing these days. I'm just going to share my screen here, pop this into presentation mode. Emmett, can you confirm that you're able to sort of hear me and see the screen and all that?
Can confirm that I can see the screen and hear you.
Okay, terrific. Well, we're off to a good start then. What I'd like to talk about today is how the behavioral insights community and the organization that I work for in particular has been trying to support the critical work of public health professionals in governments all over the world based on the sort of particular expertise and methodologies that we have. So I want to share with you a couple of sort of projects or pieces of work that we've done that I think sort of demonstrate how behavioral insights can be a really sort of useful, supportive approach when it comes to dealing with such a critical public health pandemic like this, and how it sort of fits into that bigger picture of how governments and organizations outside of government are sort of working together to try to keep our communities safe and healthy. Just to provide a little bit of background here, maybe before I get into it, as Emmett mentioned, I work for an organization called the Behavioral Insights Team, which we sometimes call BIT or BIT. And we can't help but make these terrible puns. So my slide here is titled "A Bit About BIT," which hopefully gives you a sense of just sort of how bad my sense of humor is, and you'll probably get a little bit more of that as we go through. But we've got a bit of an interesting history as an organization. We actually started out as part of the UK government in London, part of their sort of central agency, the Cabinet Office, as actually the first government team in the world that was dedicated to the application of behavioral insights. Actually, a phrase that we coined that I'll talk about a little more in a second. We've subsequently been spun out of government. So about 6 years ago in 2014, we became what's known as a social purpose company. And that's been really great for us because we've been able to extend our work outside of the British government. And we now have sort of partnerships and collaborations with governments at all levels, really all over the world, just about. And working with some great sort of nonprofits as well. And then it was my sort of great privilege and opportunity just over a year ago in 2019 to open up a Canadian office of BIT, so BIT Canada, and sort of bring this this work that we've been doing and this sort of expertise home, at least for me, which is Canada. And as an organization, the Behavioral Insights Team, so not sort of necessarily my team, but as an organization, we've been working with the National Health Service in the UK, with mayors all over the US. We've done some work with a Canadian public health unit closer to home, done some great stuff in Bangladesh and some international development contexts, all sort of around the various sort of bits and pieces of COVID-19 response. And in particular, as you'll see, with a bit of a focus on how can we sort of encourage and support and motivate those protective behaviors that people can take to reduce the risk of infection and of transmission. And if you're interested in some of what I share here on the call today, you can head over to our website. It's just bi.team, so bi.team. And you'll see we've got a whole bunch of sort of blogs and articles and reports on various aspects of the work that we're doing in and around COVID-19 response and recovery. I do want to just briefly touch on what the heck I mean, or we mean when we say behavioral insights. And this is the sort of working definition that we have. And some of you may already be really well familiar with this stuff, but I think it's still not a sort of widespread model or approach in Canadian government. So I wanted to just take a minute here to sort of share the definition and a little bit of background. So behavioral insights is an approach that uses evidence of the conscious and non-conscious drivers of human behavior to address practical issues. So, put another way, over the last couple decades, there's been all this absolutely fascinating research happening primarily in academia that's revealing a much deeper and more nuanced picture of how people process information, how they make decisions, and ultimately how they behave. And a lot of that is sort of focused on these non-conscious drivers of our behavior, of our choices, all the little sort of cues in our environment that may lead us to act a certain way versus another option. And that sort of stands in contrast to this older model of human behavior and decision-making, where people thought it was sort of all about these very rational cost-benefit calculations. Let's take all the available information and almost like computers. The thought was that people sort of process this information and make the decision that's best for them in the long run. And while that's sometimes the case, there's so much more that goes into our behavior, like our mood, who we're around, the physical environment that we're in, the sort of social context that we're in, what other people are doing, what other people are expecting us to do. All of that really plays a massive role. And the idea here is that by having a better understanding of that, behavioral insights will let us tackle some practical policy and operational issues in a way that's maybe a little bit more effective than if we didn't have that understanding of human behavior. And I'm not going to go too deep into this, but I wanted to say a little bit, not just about the nature of the work we do, applying this more nuanced and realistic model of human behavior to the day-to-day work of government. I want to mention briefly how we do it. And most of our projects follow 5 phases. And so I think if you're looking to explore applying behavioral insights in your own work, as I hope you will be, I thought this might be a bit of a helpful framework or structure in thinking about what do I need to do to apply behavioral insights? What are the key steps? And our model here, we call it TESS as a short form, and it stands for these 5 sort of phases. And the first phase is one that's really important, and I think can actually be helpful when you're addressing a policy issue, an operational issue, even if you don't do the other 4. I think there's a lot of value just in this. And what this target phase is it's all about identifying the behaviors that you're going to be seeing in the world in order to accomplish your goal. So let's say we're working on economic recovery and we're working on employment. And the outcome that we're accountable for is getting more Manitobans back to work faster. Well, there are so many behaviors that are ultimately going to support the accomplishment of that goal. Think about, unemployed people seeking out employment services. Let's think about some really effective employment coaching or counseling. Let's think about, getting out there and, sending out your resumes, applying to jobs. Let's think about prepping for interviews, developing the resume in the first place. And by getting really, really concrete and actually sort of mapping out what all those behaviors are, it can reveal the problem in a new light. But ultimately for the work that we do for the Behavioral Insights projects, we'll usually pick 1, 2, or a handful of those behaviors that feel to us like, this behavior really matters. It makes a difference in the overall goal, say applying to more jobs. And it's also something that we feel like we can support or influence given the resources that we have, that you have in wherever you sit, within government or the broader public sector. And so that target phase is all about taking a sort of big picture, policy goal, operational goal, and distilling it into 1 or more behavioral goals. But then once you've identified what those behaviors are that you want to influence, in the case of COVID-19, maybe it's about people maintaining social distance or trying to avoid, congregant indoor settings. Then you need to explore the barriers that may limit people from taking those actions. And we need to think about a really wide range of barriers. Think about, those important systemic barriers, those sort of structural barriers. But what our work does is it reveals a new sort of set of potential considerations, in particular those psychological or cognitive barriers. Are people, experiencing loneliness? And that's actually going to be a barrier to some of these behaviors. Are people really cognitively stretched? They've got way too much on their mind and they're sort of shutting down and checking out a little bit. What are their barriers in terms of what are their assumptions around other people, what other people do or what they expect them to do? So we really try to understand that through a variety of research methods, and only then do we develop our solutions, whether they're sort of nudges or something else. Nudges referring to these often very small tweaks that we can make in the to the context in which people make choices and decide how to behave, that don't really sort of bar any options. It's not like sort of regulation saying you can't do this. It's more about framing people's choices and the environment in which they make those choices, in order to sort of, as the word says, nudge them in the right direction. Now, one thing that's really important to note here, and you'll hear me as I talk about a couple of case studies, the importance of trialing, of basically sort of running, you could call them experiments, but sort of evaluations, to understand how effective are these solutions that we've developed, these nudges or these other ideas. You know, because the reality is, as much as we'd love for all of this stuff to work, it really doesn't work all the time. You know, we can have a strong theory, we can have a strong evidence base, but the context is always different. You know, what works in Toronto isn't necessarily going to work, you know, in Gimli or in Winnipeg. And what works in the context of, you know, encouraging people to wash their hands may look very different. In terms of the context of encouraging people to stay at home unless they're taking an essential, you know, trip if we're in a sort of lockdown type scenario. So running these little experiments is a really critical part of our process, and I think really fits in quite well to these broader trends in Canadian public administration around evidence-informed policy, and sort of how we give advice to government. And so we really like to be able to run those experiments and generate some really good data on, does our idea work? To what extent does it work? For whom does it work? We got to think about the sort of equity impacts here, the distributional impacts, before we can provide that really strong advice to government saying like, yeah, this is a better way to communicate, or, you know, this is what your, you know, your service design should look like. And that's that final piece of the puzzle around scale. So I think with that, I'm going to move in more to the sort of specific COVID-19 context here in a couple of these case studies. But you know, happy to come back to some of this sort of foundational stuff. I know we didn't have too much time to get into it, so happy to come back to that in the questions or to share some resources after the call. So the first point that I want to make, and I'll make it more quickly here because I think it's a relatively straightforward one, is that you know, especially in the absence of a widely available and highly effective vaccine, behavior is absolutely critical in reducing transmission, whether it's having people sort of stay at home more when they can, when it's having people sort of around hand hygiene, use of facial coverings, maintaining social distancing. This is all behavior that's happening at the individual level. And so if we can understand the drivers of that behavior and the barriers around that behavior a little better, we're going to be able to come up with more effective, you know, interventions, more effective things that we can do and deliver to the public. And our research has showed that when it comes to COVID-19, there are a few really critical barriers to behavior change. Now, it does vary based on the specific behavior that we're looking at, but some of the common ones that crop up and that you'll see us address in sort of different ways in these case studies are like, what is my perceived efficacy of this behavior? Do I really, do I feel like I'm really sort of reducing the risk to myself and maybe the people that I really love and care about by doing these things? And that leads us to think about how do we frame information about risks? It's not just about you know, giving people the data, because, you know, we process information differently, and the way we perceive that data is going to vary depending on how it's articulated to us. A second thing is that people often think that this behavior, you know, staying at home more or maintaining social distancing, especially early on in the pandemic, people actually underestimated how normal that was. They thought that their fellow, you know, Manitobans, Canadians, whatever the case may be, were sort of going out and breaking those rules or those guidelines more often than they actually are. And because we're so informed by what our peers do, that misperception of what behavior is normal actually ends up being a barrier to us taking those protective actions, which is pretty interesting. A huge one that comes across in a lot of our work is these small moments of friction, these sort of hassles that may occur in undertaking the behavior. Like, yeah, you know, I want to sanitize my hands before I go into that meeting, but I just can't find the sanitizer, or I have to go over to the bathroom and I'm already running late. So, you know, these small moments, is my mask easy to grab if I need to wear one when I'm heading out the door? Is it right there on a little peg? You know, these small changes in our environment can make quite a big difference. And then last, there are some people, and our research shows this is particularly prominent among younger men, which is sort of interesting. But there's a perception out there that, like, my risk to my health is not actually that high. You know, this is a disease that, or a virus that affects other people, or, you know, I'll be fine if I get it. And of course, there are very different implications of contracting the virus depending on who you are, your age, your health. But of course, you know, just because you don't get sick yourself doesn't mean you can't sort of transmit it to others, right? So that sort of perception around risk is a critical barrier. And as I said, we really want to sort of go out and test the ideas that we develop. But it's really hard to do that right now. And so we've been using a lot of online testing. So these examples that I'm going to show you were not tested in the real world. They were tested basically by going out and recruiting a sample of, you know, Canadians or British people or whatever the case may be, and randomly sorting them to see one of, for example, 4 different types of public health communications. And then asking them, what was this communication telling you to do? Do you intend to comply with this communication and what it's telling you to do? How do you feel about it? Do you trust it? Do you think it's credible? Do you think it's coming from a trusted source? And then we're able to compare, based on which of those communication options people saw, how do their answers to those questions differ? Right? Can, you know, a slightly different design of some public health communications increase the level to which people really understand the advice that's being provided to them, or their intent to comply with it? So that's sort of the methodology that we've been using here for the studies that I'm going to walk you through. And so the first one, this happened right at the very outset of the pandemic in March, and this is in the UK, and the National Health Service at the time felt like hand hygiene was one of the most critical protective behaviors that people could take. And they wanted to sort of design these posters, put them on, you know, billboards, in hospitals, on bus stations, et cetera, to improve hand washing. But they wanted to get a little bit of data, evidence, and some behavioral science expertise to improve those posters. And so working with them, they basically had 3 sort of options, or 2, and then we helped design the last one. And, you know, as you can see on your screen here, these options all look very similar at first blush. They flag the issue around coronavirus. They all specifically tell you to wash your hands more often, and they give you 3 additional pieces of advice in terms of using soap, washing for 20 seconds, and increasing the frequency of your hand washing. But the design of the information is a little bit different. Some of them have a little logo in the bottom right. Some of them have certain of the messages a little bit more prominent than others, bigger font and stuff like that. And what we found here, as I get into the results when we ran one of these evaluations, is that the rightmost poster, the one that sort of puts wash your hands in that big, bold font right where your eye goes, that one, and that sort of minimizes extraneous information and puts those 3 specific pieces of advice around soap and water, 20 seconds, more often than you do now, the one that makes that a little bit more salient, a little bit more immediately sort of in your face, if you will, tended to do a lot better across all the key outcomes that we were looking at, or at least the same, if not better, across all the outcomes. So basically, no matter which version people looked at, they remembered that it was all about washing your hands more often, between 93 and 96%. But if you look at the next row down, the percent that correctly recalled the sort of 20 seconds guidance was much higher when we made that more prominent and reduced the extraneous information, 69% compared to 54 or 58. And we also saw a little bit of an increase here on the proportion of people saying that they would, in fact, wash their hands more frequently. Now, we can't measure that, so we have to be a little bit skeptical about whether that's really true or not. But it's at least some indicative evidence around the actual sort of intention of the behavior. So, you know, this project is hardly rocket science, you know, sort of jokingly, I've titled this slide, "Make the key message big." But you know what? It may sound obvious, but it's powerful. Like, think about all the government communications that you receive that maybe don't meet this very fundamental test of making the key action it's being recommended or required that you take, making that really salient and prominent for the reader so that, you know what, even if I just glance at this thing, it's much more likely I really know what I'm being encouraged to do. I don't need to engage with it in detail because, you know, people are distracted, they have limited cognitive attention, limited bandwidth, they're busy, and we can't just assume people are going to read everything you put in front of them. So the next case study was an interesting one. This one was down in the States in Portland. And they, you know, one of the things is like people got to go get groceries, right? It's an essential trip. But groceries are an indoor setting where you're exposed to other people. And, you know, so there's a bit of a risk there. So they wanted a bit of our help on sort of designing in-store posters that would encourage social distancing. And so these are the posters that we developed and ultimately tested with them. And you can see they look quite similar. So they all have an image of two people with shopping carts separating them, showing 6 feet. They all have the exact same big key message: stay 6 feet apart, the more precise guidance at the bottom, wear a face covering, don't touch your face, wash your hands. That's exactly the same here. What's different is the sort of second line of text under. So one is just purely informational. It says who should stay 6 feet away. So stay 6 away from our staff and other shoppers. The other one is a little bit more motivational. It says save lives, don't spread coronavirus. Maybe that gets a little bit more at that perception of efficacy that can be a barrier. And then the last one tests a very interesting theory, and it frames social distancing actually in moral terms. Or to use the fancy academic language, if anybody prefers that, in deontological terms. It says that it's your duty to protect our staff and other shoppers. And we had actually read a paper, an interesting academic had written finding that there was some early evidence for invoking duty as a way to promote these protective behaviors. And here what we found is across these three different, you know, this simple approach, this basic pro-social save lives message, and this duty frame message, in terms of comprehending what that advice was, duty scored the best. So that was really interesting. Now they all scored about the same on the questions related to, do you intend to keep social distancing? Basically everybody in Portland was saying, yep, I'll totally do it, regardless of which of those 3 posters they were randomly selected to view. But interestingly, the trust in the message, the credibility in the message was also higher in that duty message. So one of our pieces of advice is to really test out when you're doing COVID-19 communications, really think about and test out this duty type of framing, which is quite unusual, quite sort of creative and innovative, but there's now a growing evidence base around it. And then the next one that I wanted to share here was around encouraging people to stay at home. And we'll stay in the US for this one. This was in Evanston. So actually, I think just south of the border, maybe. Gosh, my geography is so bad. But this was in Evanston, and they were putting out a lot of social media communications. That was a key part of their sort of strategy around protecting their residents. And so again, we sort of helped them develop and test 4 different key messages. And this was when things were really bad, and it was sort of that lockdown, that lockdown situation in the state. So the first one we tried is just a very simple imperative saying, stay home, save lives. period. No sort of fancy behavioral insights. No sort of fancy behavioral insights there. The next one was framed around duty again. Do your part. Do your part to keep others safe. It's your duty, right? It's not quite as explicit here, but it's sort of similar. The next one tried to invoke a sense of collective effort. Join Evanston. It's not just you. Join Evanston in the fight to save lives. And the fourth one was a strategy that we employ a fair bit in our behavioral insights projects, which is trying to communicate what other people are doing as a way to influence that individual's behavior. This is something that I mentioned a little bit earlier on in the webinar. And so here we said, your neighbors are helping to slow the spread. Join them. And otherwise, everything else was the same, the graphics and all of that. So we're really just testing the difference in the sort of language here. Small sort of nuanced changes. And here what we said is, what we saw is that in terms of people saying they would be very likely to stay home as much as possible, actually in this case, it wasn't the duty one. It was the social norms one that did best. Although you can see 3 of the 4 are in green there, which means that statistically they were tied. So social norms scored the highest, but we can't be certain that that wasn't just a result of luck. But on a couple of their other sort of behavioral intent measures, their likelihood to leave the house to hang out with friends, there we saw the sort of simple message and the social norms message doing the best. And similarly, in terms of spending time with family, a similar sort of pattern of responses. So, these are pretty small changes, and I think they reflect the fact that, you're not going to change the world with sort of nuances in the communications, but you can actually literally sort of save lives here, right? If you think about 3 or 4% reduction in some of these behaviors, if they're materialized, those little things, when you add them up over each communication, over each sort of policy intervention, those can really sort of help you bend the curve. Not a silver bullet, not a panacea. I got to say, the behavioral insight stuff rarely is, but it doesn't cost you any more to write your message in a slightly different way. And so we think, even though the overall differences here are modest, well worth doing a little bit of that thinking and a little bit of testing before we go out and start sort of firing off those communications. Or as we fire them off, there's good opportunities to measure well you're implementing as well, which we can talk more about later. I did want to bring this a little bit closer to home. We just wrapped up a project with the Canadian Public Health Authority. And I don't know if anybody here, I think it's online in Manitoba, but I'm not sure, this COVID Alert app that was sort of developed primarily by the federal government, leveraging some Bluetooth technology enabled by both Android and Apple. And so this organization that we were working with said, hey, can you help us develop some strategies to encourage people to take up this, to install this application based on behavioral insights. And so we started really digging into a whole lot of research here. And we found that there were 4 key barriers to people installing the app. So the first one was all about efficacy concerns. Like, people aren't really sure that this app helps. And it may be because they don't quite understand how contact tracing and isolation can stop the spread. It may be that they totally get that, but they don't think enough people will install the app for it to be really effective at a sort of public health population level, or they may not trust the actual sort of design of the app in terms of when it notifies of a potential, what's it called? Not disclosure, exposure, and exposure there. Another big one, and we see this all the time, the friction costs. People's perception that, like, oh, maybe you have to keep it on all the time or configure it. In fact, it's really easy. You just sort of enter your province and it runs in the background. So there's actually not a ton of friction costs, but there's still some. You have to search for it in the App Store. You might find the wrong thing. You have to hit download. You have to open it up, put your province in, and all that stuff. Privacy and data security concerns. This actually happens to be quite a good app in terms of privacy and data protection. I'm not an expert on that, but based on the experts that I've read. But of course, people express concerns around the sort of risks of sharing their data through the application. In fact, it captures almost no data. It doesn't know who you are. It doesn't know your location. But people still really are concerned about that. And I can absolutely understand why they would be, given how much of our data most apps really are sort of grabbing. And then also this point around social norms. So, it doesn't seem downloading the app, maybe unlike social distancing or unlike maybe wearing a mask indoors, downloading the app maybe doesn't seem to be as commonplace or sort of expected. And that can be a barrier too. So we ended up coming up with a bunch of recommendations here, but I wanted to share 3 of them with you. Just, thought you might sort of find it interesting, as it was it was a really fascinating project to work on, sort of trying to encourage people to install this app. So the first one is really trying to address this question of the efficacy of the app. How does it work? And, we thought there's a lot of ways you could try to do this. You could give a very sort of informational, message. If you're within 6 feet for 15 minutes, it pings these 2 codes off each other, and then you get notified of exposure, blah, blah, blah. But we thought, what? People think in stories. We process information in stories so much better than we process it in statistics. Let's give people a story of actually how this can help. And you see some great stories going around in Twitter. And so this isn't even really made up. These stories are real. But let's imagine somebody gets a notification that they've been exposed, and then they go out and they get themselves tested. They go to a testing site. Maybe they're thinking about how was I exposed? They get tested, and it turns out that they are in fact positive, even though they're not feeling symptoms, and it shows them making a different decision. Wow, I wouldn't have known I had it otherwise. I was going to see friends tonight, but now I can keep them safe, right? Or I was going to go visit my grandmother or my folks or whatever. And now I can make a better decision because I have this app. So we think the power of narrative is really important here when it comes to communicating complex information, like how this contact tracing application works. The second idea gets at this really interesting behavioral science theory around cognitive dissonance. So people seek to be consistent in their behaviors. We have an identity, we have a sort of concept of who we are, and we really want to be consistent with that identity. Because if not, we experience cognitive dissonance, and that's unpleasant, and we try to avoid it. And so what we wanted to do here is we wanted to link installing the application to other behaviors that a lot of people are already taking and that feel important. So that we could say, like, hey, if you're doing this other stuff, you should probably be doing this thing too. Otherwise, you might get some of that cognitive dissonance, which is unpleasant and which we seek to avoid. So here we said, you wear a mask, you social distance, you protect yourself and your community. Now you can download the COVID Alert app. So it's all about sort of trying to create a through line of behavioral consistency, because people really do want to be consistent in their behaviors. And then the last one here is about that social norm, that sort of powerful concept that we've talked about in the past. So simply saying, over 2 million Canadians, it might actually be 3 million now, have already downloaded the COVID Alert app, join them and help stop the spread. So that could be a powerful one too. Now, unfortunately, I don't have any nice graphs to show you. We've really encouraged the organization that we developed this for to do some testing, and hopefully they'll be able to share that data with us, and we can sort of publish it and put it out there for the community. But this one we haven't evaluated yet. But I just thought it might be interesting to you to sort of share it nonetheless. So just rounding into the end of the presentation here, so gave that brief introduction to sort of what is behavioral insights, what is the actual practice of it, what are the steps involved in doing behavioral insights work, why is behavioral insights or behavior relevant to COVID-19 response, and then 3 or 4 now sort of case studies of how we've been applying this stuff in practice. What I want to leave you with is a few of what I think are like the top priorities, things that we're already starting to work on or thinking that we probably will work on as we move hopefully into the next phase, more around sort of recovery and less around sort of crisis response. Now, I live in Toronto, and we're really smack dab in the middle of a pretty scary second wave here. So different parts of the country are in different places. But I think one of the biggest ones is going to be around vaccine uptake. And there's a whole bunch of issues around this, giving people clear information about when and how they can access the vaccine and get vaccinated, building public trust and confidence in the safety and effectiveness of the vaccine, but also being very transparent. I mean, there's a good chance here that the vaccine is not 100% effective. People may need to take boosters depending on what gets through phase 3 trials here. So, not just sort of minimizing concerns, but being really straight, but being clear and effective around building confidence. So a lot of work that needs to happen there. I think we're already seeing this. It's already really prominent, but as we've reduced contact with each other, risks around sort of loneliness and mental health, I think, in particular for a lot of older people and a lot of single people, are really significant things that really need attention. And there's recently been, including some Canadian projects that we've done, work on applying behavioral insights to find ways to encourage people to take those behaviors during the course of a day, those moments to check in with others, to reflect on their own well-being, and a few other ones as well, that are demonstrated to improve mental health and well-being and address the sort of harms of loneliness. I think about some other stuff too. We've seen some massive shifts in transportation habits here. And we'll get to a place where it's safe to return to transit, but will people do it? Have new habits been formed? What does that look like? What's the impact on the environment? What's the impact on our sort of transit authorities? And then, I think a lot about our shopping habits. Are people switching more and more to sort of online and delivery? And again, when and if it's sort of safe to do so, what's that going to mean for Main Street? What's that going to mean for those small businesses that, maybe aren't Amazon, aren't Walmart, in terms of the ability to just, fully shift to an online model and delivery and all that. So those are a few of the things that we sort of see around the corner as potential opportunities to apply behavioral insights. So that wraps us up. I'm really looking forward to taking any questions or just sort of hearing your thoughts about this stuff as well in the bit of time, the 15, 20 minutes or so that we have remaining here. Please do reach out if you want to learn more about this stuff. You can either check out our website, feel free to give me a shout, email me directly as well. And I think I'll just sort of stop there and turn it over to questions. So I hope that was interesting or useful.
Hi, Sasha, thanks very much for that. That was really interesting. So I'd invite everyone to share their questions in the chat, and I will read them out. But while we're waiting for people to put together their questions, I have one for you, and it's you mentioned that this is nudging. This is rarely a magic bullet, and I think that you can see that in the effect sizes, which are not necessarily always huge. When you're bringing ideas to governments at any level, do you have to sort of temper their expectations?
Yeah, so that's such a good question. And there's sort of two pieces of that I'd like to tackle. So, when we're doing the sort of traditional nudge stuff, which often focuses on communications or small changes in sort of process design, we really do need to manage those expectations. I mean, I could show you a couple trials where we doubled or triple things, but those are really the outliers. And so I think that expectation management is really important. I think the other thing I want to say is that behavioral insights can also be part of the process of identifying those bigger, more systematic solutions as well, where you can see those much larger impacts or effects. So if I'm thinking about that COVID alert app project, actually one of our recommendations, we had sort of 6 or 7 on messaging strategies and 3 or 4 that weren't about messaging at all. And one of them was, actually both Apple and Android can push out preloaded applications when they update their operating systems. And so one of our recommendations was actually have them default install, notify you so that you can uninstall it if you don't want it, but actually have them default install the applications on phones when they next update the operating system. And that's the sort of thing, that sort of default option. What do people have if they don't make an active choice, where you can see massive effect sizes. And that's also based on behavioral insights, right? It's based on this research observation, this insight that friction costs, finding the app, taking the minute to install it. There's a heck of a lot of people in Canada who fully intend to download the app and don't get around to it. And, so that sort of thing is going to be much larger effects than the still important effects of sort of, more effectively motivational communications strategies. And so I think, behavioral insights isn't just about nudging, even though that's sort of the best known part of it. It can also point to where we need to have, bigger policy solutions, where there's sort of legislative or regulatory barriers. And we can, that's a whole sort of separate conversation, but one that I think the field is increasingly, moving towards as we start to really understand the potential for nudge, but also the limitations of nudge and the problems that it's not going to be able to solve, even where it's not, behavior still matters, and a deeper understanding of behavior can still be really, really helpful in those more sort of traditional policy levers as well.
We added in the chat that the Manitoba, the COVID Alert app is available in Manitoba, so anyone can download it. If you work for the government of Manitoba, it actually has been downloaded as a default, but you do have to opt in using your government device, that is. Couple of thank yous. One question from Alba. I'd like to know what you think are the new considerations that should be made regarding the application of behavioral science in the context of a second wave versus the first wave, in terms of, for instance, decision fatigue.
Yeah, so really fascinating one. And frankly, there's not a ton of research on this, so I'll have to be a little bit more speculative. One of the things we found in the first wave is that people were really focused on COVID-19. It sort of had their full attention. They were, for the most part, really following the news, really worried about their own health and their family's health. And so we found that a lot of the more sort of nuanced communication strategies had small impacts or no impacts at all compared to just a simple or clear message. I'm sort of wondering if now with the second wave, now we've got the US election on our TVs and websites all the time. It's not sort of all COVID all the time. And so I'm wondering if those motivational communication strategies might end up being a little more important now than they were before, because getting our attention, attracting our attention is sort of maybe a bigger challenge on some of those public health behaviors than it was in the past. I think the second thing is that the advice is more nuanced now. So in most places, we're not in lockdown, we're bouncing around. In Ontario, they call it phase 1 reopening, phase 2 reopening, phase 3. Oh, now in this region, we're back to phase 2. And that really creates some significant challenges around comprehension. And, I think there's work that needs to be done to really simplify that and explain, what does it mean for me? What choices do I need to make differently now than I did before? Because it's hard to follow all this while remembering exactly what phase 2 reopening means versus phase 3. So I think there's some information design components of this that are more important now than they were before, because the advice is inherently a little bit more complex. And so you might focus a little bit more on that simple thing I showed you with the National Health Service around just making that key information really salient, making it big, making it grab my attention. In terms of whether people's ability or sort of self-control to comply with this public health guidance is diminishing over time, I'm not aware of any evidence, because you can make a compelling argument that that's true, but you could also make an argument that people are getting habituated to maintaining social distance or reducing their social contacts. They're finding ways to connect with their parents online a little more, getting more comfortable with FaceTime. And I've not seen any data to suggest one direction or the other. So I think it's an important question, but one that I can't sort of meaningfully speculate on. I will say though, I worry more and more about the long-term effects, especially around mental health, well-being, and just the sense of connection that we have. I think people that were sort of at risk or experiencing mental health challenges, as frankly so many of us really are. This isn't my expertise. I'm not a clinical psychologist. So maybe this is more just from my own experience and, my family and friends and stuff like that. But I think we need to be doing more, from a government perspective, but also just from a society perspective, to be finding ways to reach out and provide support and build connection and check in with people, because of how long this thing is going on for, and because of the sort of cumulative toll, maybe that it takes. But again, it's not my specific area of expertise, so take that with a grain of salt.
Question from Alexandra. Can you please describe how you measure public opinion in your research?
Yeah, for sure. So we are not a market research company. And so, I don't want to sort of set us out as experts, but, the way that we're measuring, at least in these examples that I showed you, we're actually trying to measure not so much opinion, but really three things. So the first thing is comprehension. Do you actually understand what government is communicating to you? Can you answer factual questions about when it's the guidance is to wear a facial covering or a mask and when it isn't? So that's the first dimension, and that's one that we feel really confident on the measurement and our sort of and our approach to it, which I'll say more about in a second. The second dimension of how we sort of measure public reaction is around behavioral intent. Do people say that they're likely to do the thing that they're being asked to do? And again, we're cautious around our interpretation of that data, but if people who see a certain message say they're way more likely to do something than others, we do have some data that in reality, they probably are more likely to do that thing. Although, again, there's just some real limitations to that. And the third thing, which we feel comfortable on the measurement of, is sentiment towards the message. And this is so important in particular for government. Communications, it doesn't just need to be understandable. It doesn't just need to promote intention to act. It needs to be seen as credible for both political and public administration reasons. So those are sort of the three dimensions that we tend to measure. The way we measure it is quite different than the sort of traditional survey, POR, public opinion research approach. And it's that we measure it differentially. So we measure it sort of experimentally. So we'll actually expose people to different potential communications, different videos, different social media campaigns, and then we'll see whether they're more likely or not to understand, to intend to comply, to have a positive sentiment, based on which version they see. And so that provides us with a level of evidence around not just where the public is at, not just sort of how they're feeling, what they're doing, but in fact, sort of differentially, how do our communications options shift those three dimensions of measurement? So it's sort of distinct from public opinion research. It doesn't replace it, but I think it has advantages, in particular, answering those questions about the impact of our communications in a more rigorous way. I hope that answers the question. I'm aware that it may not have.
Hopefully Alexandra can follow up. If not, question I have is, so one thing that has come to mind for me a couple of times is the thought of the comparator with this and the Second World War, not obviously for the soldiers, but for the people who stayed home and the collective efforts of rationing and those kinds of things. And I wonder, are there lessons we can draw from these previous big public events?
Yeah, and I'm afraid it's really fascinating. I've thought about that too. I don't actually have the sort of historical, knowledge around that. I think the threat does feel really large from COVID. Maybe not the same type of existential, threat to our families' lives, our sort of way of living as in World War II. But I think, when we do have those external shocks that feel really big, it can galvanize collective action. It shifts our sort of frame of thinking and our willingness to do things. There's an interesting researcher, her name is Katie Milkman, and she's really one of the sort of leading lights of behavioral science research. And she sort of developed this theory, which has become quite well evidenced around what she calls a fresh start effect. And her basic hypothesis is that it's extremely hard for people to change their behaviors. We are really creatures of habit, that sort of phrase. But that there are certain changes in our life, maybe having a child, maybe moving to a new job, having a milestone birthday, even New Year's Day, where it sort of creates this new openness to changing our behaviors and changing our habits. And I think things, like a war and to a lesser extent, like a pandemic, do in a sort of macro level way, in a very sort of dramatic way, create this fresh start. I mean, fresh start sounds positive. Nothing about this pandemic, as far as I can tell, is positive. So I don't mean that I mean it in a sort of technical way of like this. It means that behavior change right now, and in particular the type of collective action, protecting each other, caring for each other, is more likely to be created now. And that's why I'm sort of interested in, can we channel this energy around protecting each other from a public health perspective? Can we channel that to help protect each other from that sort of mental health and well-being perspective, or these other sort of, pro-social sorts of actions that we can take? Are there ways to channel that feeling that we now have of sort of being in it together and caring about each other towards sort of other important things in addition to infection prevention and control?
All right, thank you very much. Hopefully that's the case. We are at about time here, and seeing no further questions, I do want to respect Sasha's commitment. So thanks very much for this. It's very interesting. Reminder that for anyone who missed part of this or wants to share it with their colleagues, this will be recorded, or has been recorded, will be put online at a later date. But other than that, thanks again, Sasha.
Thank you.
Hopefully see people at our next IPAC event. Thanks, everyone.
Have a great afternoon, everyone. Thanks so much. Bye.
Bye.